Community Spotlight, powered by ATB Wealth Kelowna. Ready to take a powerful step towards the future you want today? Connect with local advisors at ATB Wealth Kelowna to get started.
I'm Jim Check with Now Media with another ATB Wealth Community Spotlight, where we spotlight great businesses in Kelowna here. And here we have Kyle Horvath here with us with the Newly Institute, a Newly business in town here. Why don't you tell us a little bit about what the Newly Institute is? I guess start off there.
Great, absolutely. Well, thanks for having me. I appreciate it. The Newly Institute is an outpatient mental health clinic. So we provide a variety of different services, honestly, for really focused on mental health for things like trauma, depression, PTSD, anxiety, addictions, chronic pain, and really we have a focus on wellness as well too. So we see all of these, but we know that there's certainly a combination of concerns that people could be experiencing, and we really want to help people get through their goals to where they want to be in their wellness.
So you guys have offices or clinics located across Canada?
Across Canada, that's right. We have 5 locations. We started in Calgary, that's kind of our head office, and then from Calgary we went to Fredericton, Edmonton, Kelowna, and then in Halifax as well too.
It's kind of like all over.
Coast to coast, yeah.
There you go, coast to coast, there you go.
Helping Canadians everywhere. That's
there you go. And why Kelowna? Why did you guys decide on Kelowna?
Well, there's a few different reasons, but one of them was some of the strategic partnerships that we had working with groups like WorkSafe BC, wanting to support the RCMP, the veterans, and really just help the Kelowna community as well too. So when we were working with some of our partners like WorkSafe, like the RCMP, they said there's a need in the Okanagan. We need someone's help to provide your services there, and so it really made a lot of sense for us to be here.
A lot of those are high-stress jobs for sure, and WorkSafe too, like a lot of like PTSD stuff and that involved with the RCMP and that stuff as well.
Yeah, absolutely. PTSD is sort of where we cut our teeth. It's our bread and butter in a sense. It's where we got to start. But we've really grown, and in Kelowna, we provide a really specialized chronic pain and medication management program as well too, to help people manage. Of course, with chronic pain, there's also a mental health component there too, and they really go hand in hand. And by addressing both, we can really help people get better.
So it's more than just counseling; it's also medical treatment, like ketamine and stuff like that too. Is that?
That's right. We can also offer ketamine treatment as well. We offer that in most of our clinics. In Kelowna, we're going to be offering it in just a few months. There's some regulations, things that we had to go through to make sure that we're offering it as safely as possible. That's always important to us. We have a really great protocol and regimen that's evidence-based, built by psychiatrists, through counselors, and we can offer that as well too, to help people be successful in their mental health goals.
So you mentioned that you're dealing with some larger organizations, WorkSafe BC, the RCMP and that. Look at that, eh?
Yeah, important. Yeah,
That's what happens when you're live, right?
Exactly. Yeah.
Anyway, you're dealing with, but what if it's just like a person like myself that wants to get access?
Absolutely. We are open to the public as well too. So of course we specialize and we work with first responders, but we work with anyone needing mental health concerns too.
So do they need a referral, or how do they?
No referral needed. They can contact
okay.
us. It's really easy through our website. You can give us a call as well too. There's general inquiry places.
We put the website up there, right?
So on the website, if you go to the locations, you contact us. There's an easy to fill out form. You can provide as much or as little information as you want. Someone's going to contact you right away, talk about our services. We offer a breadth of services, everything from kind of just individual therapy, working one-to-one with someone, all the way to intensive therapy, day-type programs as well. So we really want to be able to provide these range of services to meet people where they're at, but really help take them to where they want to be as well.
So was any of this covered by your BC Medical, or is this covered by your extended health benefits? Or?
It's a great question. So some parts are covered by MSP. Unfortunately, the therapy and counseling, it isn't covered by MSP, and it's not covered by most provincial health plans. But we certainly can bill through extended healthcare benefits and help people maximize those benefits to make sure that to reduce those barriers to access.
Especially if people have health spending accounts, I imagine that's the
health spending accounts tend to be the most flexible.
Yeah, because you can kind of do what you want or need to do, I guess is the question.
Exactly.
And mental health has never been, I guess, more prominent in a lot of people, especially going through these economic times. People are stressed financially as well, and then obviously that relates into their daily lives as well.
Yeah.
And then I guess once they fill out a form, does somebody contact them, or what are the steps involved?
Someone will contact them, and I guess before that, you're really right. Mental health people are starting to talk about it more. There's still a bit of a stigma, but I think society is doing a great job of helping break that down. What we really want to focus on is the education piece around that, to help people understand that it doesn't have to be a debilitating illness. It doesn't have to be crippling anxiety or a hospital stay. Mental wellness is really a cornerstone or a foundation of someone's general wellness. And there's so many ways we can help people, even if they feel, I just kind of want to perform better. That's a way that we can help them.
So even like a checkup kind of thing? Is that kind of like, you know what I mean? Like just to see where you're at kind of thing?
Exactly. To see where they're at, or sometimes people say, I feel like I'm doing pretty good, but I just want to be a little bit better. I think I can be 10%, 20% better. We help everything from people who are really suffering to people just wanting to get to that sort of next step in their life as well too. And once someone contacts us, someone from the clinic will contact them by their preferred method, either phone or email. The client can indicate. We'll do some education about what we do, answer any questions they have, because lots of times when people are contacting us, they say, I'm not even quite sure what's going on. I don't know what I'm experiencing. And we can kind of help talk them through what therapy is going to be like, what services we offer, who they're going to talk to, what that's going to look like. And we're always welcome to have people into the clinic so they can have a tour as well, so they can kind of see the space, feel comfortable. All the spaces are built to feel like they're focused on wellness. They're honestly meant to look like spas or wellness facilities. They're not meant to feel clinical or sterile. We really want people feeling comfortable when they're in.
So where's the Kelowna location?
The Kelowna location is just on Touch Street.
Also in the Pandozzi Village area, kind of like a funky little area, yeah?
Yeah, it's great, it's nice. There's parking available, which is always everyone's number one concern, which is important. And there's lots of coffee shops
Calgary,
available.
there's a parking concern for sure.
yeah, in Calgary there's always parking concern,
Yeah, so that's great little area. And then can people just walk into, or should they do the form first, or?
Either really. We're happy if people walk in. There's always someone at the desk to answer their questions. They can, book an appointment or an inquiry call. We do discovery calls and consult calls, which are no obligation, because we understand that people are just trying to get the information that they need for their next steps. So we're welcome to walk in and take a look around as well.
I'm hearing more about ketamine treatments and that. Is that something that is kind of being used more for mental health now too?
Yep, you bet. So ketamine treatment, interestingly enough, has been used for a really long time for mental health treatment, primarily around treatment-resistant depression. But over the last little while, a lot of research has come out about how ketamine, maybe you could call it a sort of a catalyst or an adjunct to help therapy become more successful. And it does these in a variety of ways that we could probably do a whole segment on, to be honest. But what we've done is really looked through the evidence, really filed through it to make sure that we built a protocol that's based in good quality therapy, getting the most out of the ketamine treatment, and providing it in an effective way.
So it's kind of like a pain management / mental health kind of thing too?
Yeah, it's used for pain quite often as well, in a variety of different ways. It's used in depression. We've really been seeing a lot of great outcomes around trauma, especially people who are experiencing ruminative or repetitive thought patterns. We've really seen that, and it's been starting to be studied and used in some addictions and substance use treatment as well. So it's really a treatment that's taken off to hopefully provide some support, kind of that boost up in the mental health treatment world.
There you go. So like just down on Touch Street.
Yep. And
then the form, let's put the website back up there as well. Is there anything that people should know about, like what, obviously you've got your staff there as well, right? So.
Yeah, so we have big interdisciplinary teams. So we have, we have psychologists, we have occupational therapists, we have registered counselors, we have nurses, we have psychiatrists, addictions and medicine doctors. We really want to aim to be sort of a one-stop shop to help provide a real well-rounded approach to mental well-being. Now, having said that, some people might choose to just work with a counselor. Some people might choose to do a more comprehensive treatment plan.
Right.
We really want to be available for what the person needs.
So you come in, you do kind of the intake, and then kind of you'll get assessed, and then recommendations as to who you should be dealing with, or what the treatments might be.
Exactly. So sometimes people have a clear idea. They say, I want to work with a new counselor. My other counselor moved or retired, or I'm just looking for someone new. Sometimes people are saying, I'm not quite sure what I'm looking for, and that's our job to really dive in, work through it with them, talk through them through that intake. We do a variety of different assessments, treatment planning, and then we'll create some recommendations that are tailored to the person to help get their goals, to help meet their goals, right? Because we could have a few different people with depression or multiple people with trauma or PTSD. It doesn't mean that it's affecting them all in the same way. There's going to be similarities, but we need to adjust the treatment methods, the treatment plan, to really meet the individual's needs.
Yeah, so obviously there's budgeting involved, and if you have your health plan, that helps a lot. I imagine the health spending account helps a lot too. So you outline that like in the treatment thing for people when they come in, kind of thing, and what they can expect, kind of thing.
A full understanding of the cost, the breakdown, what they're paying for, what services they're getting, and one thing that we've really wanted to focus on is providing really great value. I think people get a lot out of the programs that we provide, and we've done everything that we can to make them accessible, to make sure that and there's not too many barriers for people to get help.
And obviously, it is better, like if you have the RCMP that are picking up the cost or something like that, to get your employer to kind of, is there like corporate accounts that can get signed up to, where you is there something for corporations that they can do things for their employees?
We work with a variety of corporations, whether that's providing our programs or even working with the corporations to help tailor something specific to their needs. So again, this could be for more intensive treatment. We work with a variety of corporations around substance treatment, but we also work with corporations to help do mental health training and mental health education in the workplace. So we have some set curriculum things around professional quality of life, balancing work and life outcomes, around stress management, but we've also worked with companies and groups to really build specific training plans to their organization. So we worked with one group, they said, our leaders really want to help their team talk about mental health, but they don't know where to start. They don't know what's okay to say, they don't know what's not okay to say, and so we worked with them to help provide them with some skills, some understanding and education so that they could support their teams in the way they wanted to.
So if you're a corporation or a business listening, then if you wanted to add to your benefits plan, because I know benefits are such a huge thing for lots of people when they're employees, when they're looking, they want to make sure they get a benefits plan. But then this would be an addition or part of the benefits plan, I guess.
Exactly. It could be in the benefits plan. It could be sort of an HR protocol as well. It could be, we could work flexibly within what's included in a workplace's benefits plan or within their health spending account as well too. We can really be flexible because like I've said a few times now, but we want to make sure that we're navigating and reducing barriers, right? So we're happy to be flexible where we can be.
There you go. Anything else you want to add?
You know, I just want to
covered off lots, yeah.
We covered off a lot, but I just want to encourage people to reach out, whether it's to the Newly Institute or to wherever, to start those conversations around their mental health. Most people are affected, whether it's directly to themselves, whether it's someone that they know. And again, to repeat myself with my earlier point, it doesn't have to be when the anxiety gets out of control or the depression is so much that people can't leave their homes. The earlier we can connect with people, the better the outcomes are, and there's a variety of people really wanting to support and help these individuals from all walks of life.
Yeah, so the website address again is thenewly.ca.
That's right, thenewly.ca, www.thenewly.ca.
So there you go. Thenewly.ca, and we'll put it in the comments as well. And we're going to do a story with this as well. And we do want to make sure we thank ATB Wealth, because they are the ones funding these community spotlights. They're a great community partner here as well, and making sure that businesses like yourselves get a spotlight. Absolutely. And again, thank you to ATB Wealth. And we do thank you for watching Now Media.
Community Spotlight, powered by ATB Wealth Kelowna. Ready to take a powerful step towards the future you want today? Connect with local advisors at ATB Wealth Kelowna to get started.